that idea that poor people are fat in the United States, and there's a high correlation. I think a lot of people don't understand that. They get that if you overeat and that you've got such abundance at your table that you can just eat as much as you want for as long as you want leads to being overweight. That's one thing. But why are poor people so in danger of being overweight?
Well, I think that, it becomes that issue of affordability, and also becomes the issue of food deserts, which is being in a location, whether it's rural or urban, where you have less access to those fresh, nutritious foods. But it's also a process of education and, making those decisions of, after I've worked one job or two jobs, am I going to go to a place where I can buy processed food that's readily available, or is there a way that, with that same amount of money that we can purchase and cook a meal at home, or, begin to figure out a way that we can make healthy eating and healthy lifestyle a normal part of life. But at the same time, obesity really isn't just a low-income epidemic, it's an American epidemic. And a lot of research is in the pipeline at looking at what those correlations are. The White House Task Force on Obesity looked at, what are those factors that could contribute to obesity? How can we better examine the issue of malnourishment, which really hits the heart of, still eating, consuming, having that excess of calories, but not with the health and nutrition that we all need. But we know that for children, especially Latino children, there is a correlation between health and diet and academic success, even social behavioral issues. So, when we're talking about a community that is the fastest growing demographic in the country, the youngest demographic in the country, it's very important that Latinos begin to talk about these issues at home, even at the kitchen table, at schools, get involved, ask your teachers, ask the school principal, even talk to other parents about what you can do at the local level and what tools and resources are available at the federal, national, even state level that can help us get toward a solution that will make a difference for the future.
Let's talk about the government role here. We as Americans are always conflicted about where government belongs and where it doesn't. But the U.S. government also provides a great deal of nutritional assistance to families who have low income. If you said, well, we'll give you assistance in the form of these coupons, in the form of these tickets, in the form of a debit card for which you can use to buy groceries. What if you gave a very specific list? We won't pay for this. We won't pay for this snack item. We won't pay for this dessert. We won't pay for this beverage. Would people be still free to make their own choices? Or if you ask for help, do you already assume that you have less freedom as part of the whole package?
Well, we have not just one program. I mean, you're referring to the SNAP program, formerly known as the food stamp program. We have 15 nutrition assistance programs. And they are helping right now 1 out of 4 individuals in the U.S. SNAP has become so important that we're helping 1 out of 7. And it is an ability, it provides a vehicle for people that either are struggling to put food on the table or think to themselves, well, we're getting by, we're okay, we don't need that assistance. It can provide that financial cushion so that you can make better choices.
No, but 1 out of 4 is 75 million people. Is the government of the United States ready to say, okay, we'll help you, but we're not going to buy you cupcakes?
When you begin to talk about the issue of food choice, what we think is more powerful is to provide the tools and education to clients themselves so that they can make the right choices. There are over 400,000 products available in the market today. The average supermarket has over 40,000 products alone. And even though we've made great strides in terms of having an EBT card for those benefits because food stamps no longer exist, when you actually get into the task of distinguishing, which sweetened beverage is better and which one is healthy, the line begins to blur very quickly. And being able to keep pace with all the new products is truly a daunting task.
Okay, so it sounds like you're saying we're not going to tell people not to get the cupcake. But do we know that if we give people information, armed with information, they will make the right choice? Do we know that?
We know that eating well in moderation is the key. I mean, we have the dietary guidelines that talk, and the food pyramid, right? The My Pyramid that talks about the balance. So to begin that slippery slope of saying which foods are bad, which foods are good, becomes a tricky business. But what we think is more powerful is giving people the tools and the ability that they need so that they can make those choices, and those choices can become the norm of being able to balance whether, it's how am I going to budget for this week's groceries, or how am I going to budget and manage having fruits and vegetables and some form of whole grains today, so we're not only eating carbs. I mean, those types of decisions is really what will fundamentally instill a long-term behavioral change. And that's what we really, really need in a culture that, is at the same time paradoxically obsessed with food and dieting, but we need to better embrace a more sustainable, healthier lifestyle.